Well, welcome back everyone. Lights, camera, action. It's Make Our World Your Runway. And you know this is the weekly show that interviews the most fascinating individuals from the world of modeling, fashion, beauty, business, and even the entertainment industry. And as always, we have a very exciting show planned for you today. But before we begin, we always like to make a few special announcements and always thank the sponsors that make this show so possible. And that happens to be Lasky Architect, Lux Salon, Margaritaville at Sea, 100 Successful Women in Business, the Transmedia Group, Global Trade Chamber, and Vida Designs. So sponsors, thank you so much for making this show possible. And I also like to tell our viewers, remember to subscribe to the Global Trade Chamber YouTube channel so that you can see all the shows from Make Our World Your Runway and Success Stories. And I highly recommend our viewers to tune into Success Stories, because this show features the most amazing women in the world, from business and community service, from their humble beginnings to successful entrepreneurs. These women will totally inspire you. So once again, remember to subscribe to the Global Trade Chamber YouTube channel so that you can see all the shows from Make Our World Your Runway and Success Stories. And we want to let you know to get ready for some exciting conferences, speakers, and awards, as 100 Successful Women in Business and the Global Trade Chamber are going to come to a city near you. And of course, many people have asked, what is that city? That is going to be Miami, Florida, November 4th and 5th. And we're calling all successful women in business because it's time to shine a light on your achievements. Now, at this show, there's going to be an award ceremony, networking, conferences, business expo, fashion show, and once again, yours truly, from Make Our World Your Runway, will be there, and I will be doing live interviews. Now, these events are free, but you must sign up. So please go to the website at www.100swb.com for all the information. And if you want to be a speaker and an exhibitor, there's information on the website as well too. And this is going to be a sellout show. We're not only going to have people from the United States, but from around the world. It's going to be one of the biggest international shows of the year. So please sign up now, because take it from me, I've been to these shows, they sell out months in advance. So once again, the website, www.100swb.com, and all the information is there. And now, ladies and gentlemen, as I always tell you, we have a very exciting show planned today, and this is very exciting. Once before, we've done some shows about health, and we are going back into that arena today. And the company that we're going to introduce to you is Nutraceuticals Corporation. It's a groundbreaking biotech company that has two complementary areas of focus. It's an advanced medical device company that is revolutionizing an adaptability of metered-dose inhalers, okay? And through their development and acquisition of patents and technologies, Nutra is now at a late stage of achieving its goals and has developed significant relationships with some of the inhalation industry's largest and longest serving participants. But of course, to really tell you all about this phenomenal company, in the studio today, I happen to have the president of this company who could really tell you what these products are all about, and he's going to take it from there. So ladies and gentlemen, please join me in welcome Sean Berrier to Make Our World Your Runway. Welcome, Sean.
Thank you very much for having me, Angela.
Oh, of course.
So they promoted me to CEO.
Oh, they promoted you. They did the same with me recently. So I know that feeling. People say, oh, you're CEO. I said, yeah, I have my own version of what that really means. I said, but
This means they chop your head off first.
thank you. Yes, I get my head chopped off every day. So, but anyway, you got to tell us about these products, because they are, from what I'm reading, absolutely amazing.
They are. So what we've done is we've taken your traditional actuators, we've brought them up to the 21st century and beyond. These are both child-proof inhalers. So a child-proof inhaler is usually a two motion, which would be one twist and actuate. Our newest version is actually two or three. So you push the button, twist it, and then actuate.
Wow.
So these are the only ones in the world that are like this. We have patents on 3 continents for these. And then we're moving on to other smart inhalers now, which we have here, that should revolution the medical space for patients and doctors, and how they connect and how they stay current, and how the medical field should adapt quickly, and it's needed. That also connects to a Fitbit or your smartwatch and your iPhone or Android. So the app will have AI in it. And to tell you a little bit more, I guess we can go into that. With this product, we're updating it to a lip reader and finger reader. And most people don't know this, but your lips are very unique as your fingerprint. I found that out 6 months ago as we were looking into the technology that we acquired. We have a license agreement with the company. So basically the lip reader will go here along with the finger. So I couldn't give you a dose of my medicine. It's only going to be for me as I put this on here and then actuate. So it's very unique, very cool. And this grabs the data. There's two parts. This part will be where the can goes in. When you go to the doctor, you'll get this piece with the can in it, so it saves pharmaceutical companies money on production. So this piece has a chip in it, and the can will go in here, and this will be what you get from the pharmacy with the drug. This piece will go to the patient. We will hopefully have this picked up by insurance soon as we get it launched out. And so they'll own this piece. There'll be insurance on it in case the dog chews up or we run it over, right? So we've kind of felt like we thought of everything. But as these two go together, when you put these together, this is rechargeable. So as this goes together, now it's connected and it starts your 100 dose, dose counter, and everything's ready to go. So then basically now you have this. Let's say it's COPD. It's already on the market because there's 6 or 7 drugs out there that are already approved by the FDA that these are ready for, all these devices.
Which is great.
Yeah, it is good. So let's say the main problem I think is with big pharma and pharmaceutical companies is the patient goes home, they use it, they don't use it properly, and then they come back to the doctor and say, I need something else. So they switch them to another drug. Well, that's not good for the pharmaceutical companies because they lose a patient that way, and that happens apparently all the time. So now what's happening is they take it home, they use it, the information goes into the cloud, then it goes to the doctor's office. So they go back into the doctor's office and say, hey, look, it's not working for me, it worked for the first month, I'm having issues, I need another drug. So he'll go on and say, okay, let's take a look at what you're doing. He'll go to the laptop, pull up the information from the cloud, and then he'll realize, well, instead of doing it 3 times a day, you've only done it 1 time a day. You dropped off, you missed a few days. No wonder it's not working for you. Go back and watch the video and proceed with the prescription base that we told you how to use the drug. And so they save that patient. The patient goes back, uses it properly, they get a better result, and everybody wins. And then what you're also doing is you're collecting data, which everyone knows now is very, very lucrative and needed, especially in the medical field. Companies spend millions and billions of dollars to collect data. So that's how what we're thinking is, we're going to kind of bring it together for the pharmaceutical company. Instead of buying the data, they can collect it now themselves in real time, and it goes back over from the doctor. They can pull that data in themselves because they'll own the device as a license agreement, and they won't have to pay for it. So it's going to save them quite a bit of money.
That happens to be excellent, okay? There is somebody I have to introduce you to, okay? We haven't had her on the show, but she does a lot of work with the chamber. But I definitely want to get her on my show because a few weeks ago we did a Zoom meeting with all the chamber members with her. And she is very big into artificial intelligence. Her whole company is about that. She goes around the country giving speeches. She mentioned the medical profession, okay? And she talked about, not of course what you're doing, but something like this, and how doctors are actually using AI and artificial intelligence now. And I brought this up. I didn't realize it, and as she was talking, when I had my hip operated on back in 2015, the doctor that did my hip, he was not only an orthopedic surgeon, but he was also a neurosurgeon. Okay. I didn't realize it. Back then, he was using AI. And what he did with my hip, not just putting the hip in, okay, with the hip, he connected it, he extended it to the back of the spine so that the brain could automatically start sending signals.
Really?
Yeah. I didn't realize that till I went back and actually read the papers on this. And that's why the day that he operated on me, the next day, I was totally straight and able to walk. Okay? I thought I was a robot. I really did. I thought I was a robot because I said...
Makes $6 million woman?
Exactly.
If anybody remembers that show, I did.
Oh, I remember that show, $6 Million Woman. Yes, I remember that with Lindsay Wagner. Oh, that was a great show. But, so, even back then, they were starting to, okay? And he had said to me, he said, I'll get a transmission, he says, from this. If there's something wrong with the hip, we'll know it.
Oh.
And I'll be honest with you, I didn't even have to take Tylenol after I was operated on.
Wow.
Never had to take a painkiller. Till this day, never had to. So, what you're saying, okay, and what you're doing, there's so much innovative things going on.
Yeah.
And especially with what I had done, it's like...
AI is truly amazing. And the other piece of this is there's 3 ways this is going to save the medical or a pharmaceutical company. So, last year in 2024, the highest company that collected data basically sold $554 billion worth of data.
Oh.
One company. Now the smallest company was 400 million. So if we can somewhere fit one of these pharmaceutical companies, or if we collect the data ourselves, then that's a big, up for our shareholders. The other thing is clinical trials. They fail quite a bit because the data or the people they hire, they'll put patients in that don't even actually have that problem because they're just trying to collect the money from a pharmaceutical company if they don't run their own clinical trials. So this way we can save clinical trials 30 to 40%.
Which is great.
It's huge. I mean, just
5%
they'd be interested in. And then the last piece is, that little piece that you get in a prescription you have to fold out and read?
Right, exactly.
Have you ever read one?
Believe it or not, no.
Yeah, no one has. So that costs the company at least 10 cents to 5 cents to put that on every
Yes.
right? So we'll eliminate that because it'll be on your phone. You go to the pharmacy, you pull up your app, you open it up, just like the iPhone. Did you read your, the updated? And everyone
Exactly.
says yes, they never read it. So whether you read it or not, it's now on your phone.
It's now on the phone.
You can
yeah.
throw that away. You don't need to print that anymore. And then you can say I accept it, and then that you watch the video for the teaching you how to take this drug and the way to do it. That's going to be huge. And then there's another piece to that is everyone, if you watch TV or watch the Super Bowl, you see 15 different drug companies advertising.
Exactly.
So that's less than 1% that they're actually hitting their target. This way, now pharmaceuticals, you can advertise straight to the patient at 100% target rate. You can give coupons for your next prescription. You can tell the patient when the next prescription's ready. It's all right here on the app through the smart inhaler of Optimus.
And it's funny you should say that about if you ever read one of those papers that comes inside, because my pharmacist and I were just talking about that. And I love him. This guy, George, he's great. And when I go get a prescription, he goes, Angela, do you have any questions? And I go, yeah. And he goes, don't read that stuff inside. I'm going to tell you what it does. And I'm like, and what he has started to do is, like somebody like me, he knows I have a heart condition and so on. He'll actually start texting information on the phone. I mean, this guy is great. They just made him in charge of all the pharmacies in the South Florida area, okay? And I think he said he's going to pick up the whole state now. And he's only in a couple of days a week, but he travels. But I can get him by phone or by text. And if something new is coming out, he'll actually text me and say, look, I think for the medicines you are, for the condition you have, this is going to be beneficial.
Yeah. And that's what we could do now. He doesn't have to text. He can put that on a group email, and it'll go straight, or even a text, I guess, and it goes to all his patients
Yeah.
that have the same prescription that you do, and it's going to be similar, and he can keep up with that as well, because pharmacists will have access to this too, because we want to bring everybody together so everyone knows what's going on, because right now the pharmacists they only contact the doctors by phone. There's no other way.
There's no, exactly.
Right? And
exactly.
it's that or email, but mostly there's a lag in the communication. So this way we're just trying to bring everything up to today's standards and beyond, and we want to integrate AI because that's where we're going. And we just want to make it better for patients out there and safer with the childproof that they know, we know, and the patient knows and the doctor knows that there's no way this is going to get misused by anybody else.
No, it's not going to get misused, and that's why I say I got to get you with this girl Jenny with AI. Oh my God, she'd be all over this, and she'd really promote it.
Well, and this, and again, here you have the savings because here you have the dust cap, right?
Exactly.
That costs money as well. This way, there's no dust cap. You got the little dust caps inside with the green, and you can change these infinite colors with the drug. So if a company says, hey, our colors are this, you can change this actuator to the colors of your company. And it looks snazzy anyway. I mean, have you ever seen an actuator look like that before?
No, that is snazzy.
Yeah, it's pretty cool. I'm happy with what we've come up with, and I think we'll be able to sell this all around the world.
See, now somebody like me, I carried out, I said, oh, listen, somebody, if I pull this out of my bag, I would say, oh, this is something new in the cosmetic industry. And don't laugh. This is eventually, it probably could work in the cosmetic industry. When they have that spray where women spray on their face to dry them. That's an idea.
Yeah.
You just gave me an idea. I'm gonna call up the head of Lancome. That's where I used to work for, and say, I got a great product.
Because because it locks in your purse. Instead of having a little plastic cap on it, you might be able to use that way. I didn't think about that. That's actually pretty smart.
Yeah, because you got this bottle and you're trying to spray your face, okay, to freshen up the makeup.
There's 100 actuations up to 200 you can put in there.
Wow,
Yeah.
that is great. Yeah, that's a great idea. That'll save me
You
a
heard
lot
it first
of time.
here.
Yeah, that'll save me a lot of time and money too, because it's true. I mean, looking at something like this, you could just throw it in your bag, use it. It's great. If you're on a plane or something,
Absolutely.
take it out of the bag and use it. Not have to call the stewardess and say, hey, I need something. So this is an excellent product.
Well, and it actually, Nutra's doing even more now in the pharmaceutical space. So we're almost slotted out. We've done our IRB application is approved, our WCG, our protocol, and our brochure is all approved right now. We're going to do a clinical trial with our device.
Wow.
With CBD for acute anxiety, because 1 out of 5 patients have anxiety in the country. And I think there maybe been a report, maybe it might be 1.5 to 2 patients now, or people in the United States with anxiety. Now, I don't think there's ever going to be a cure for anxiety, but this will support it. Our patented, soon-to-be granted formulation. It's all natural botanical. We've talked to some people on both sides of the aisle. They like it. We're going to make our application out. We should be in front of the FDA hopefully in the next 30 to 60 days to discuss what we're doing. We feel confident that we'll get a yes on the first phase 1, which is 30 patients, 30 days. And we're looking forward to the data because, as you know, doctors have books that they spend 6 weeks class on how to dose their patients.
Right.
And right now there's really nothing out there for cannabinoids, and this is CBD's non-psychoactive, there's no THC in it, it's just the molecule CBD, so there's no effects of that. I'm really happy with the product that we have. We have other compounds that we're doing as well. That we'll roll out later. I could talk about it, something to talk about for the next show.
Oh, absolutely. Yeah, we're going to do a whole thing on this show.
Yeah, so we're excited about it. We're an emerging company. We also have a firm commitment to be a pubco. We're going to go be on NASDAQ, an IPO, straight uplift. We should have that done in the next 6 to 8 months, hopefully sooner than later. So you'll also be able to find us and be able to look us up that way.
That'd be great. You need to get on that morning show, MSNBC. You need to definitely be on there. They're always looking for stories like this.
Yeah.
Okay, so that's where you need to be. In fact, if I called up Joe Scarborough tomorrow, he'd say, uh-oh, guess who's calling now? Because they always have the call lines open. And I'm always busting his horns. And they live right here in Florida. I think they're on the coast. But and you got to go ring the bell.
I do. I'm looking forward to that, but mostly looking forward to helping people with acute anxiety.
Yes.
And with a pure botanical, non-petroleum-based drug, with we hope little to zero side effects. Cannabis has been used for over 2,000 years. We feel it's safe. We're going to prove it.
It is. And you know, it's funny. We only have about 5 minutes left, but I want to take that anxiety to a next level.
Yeah.
My cardiologist, that's one thing he just said to me not too long ago. And you're right, there's people that suffer from anxiety. It could be anything.
Yeah, anything.
And he always says to me when I walk in the office, and he just did a test on me, he said, if I didn't know that you had a heart condition or had a heart attack or stents, I'd never know you had a heart condition. He says the heart relaxes when it's supposed to. It gets excited when it's supposed to. He says it does exactly what it's supposed to do. He said in every phase. And then he said, why do you not suffer from anxiety? He said, what is your secret? He says, because every patient that comes in here has that problem. So the minute they have a problem with the heart, things happen. I said, you want to know something, Doc? I don't think about it. That was yesterday.
Yeah.
Today's today. If I sit and think about that day that I went into surgery, I'd be 6 feet under right now.
Yeah.
Can't do that. I'm a person that thinks, okay, I'm here now. Where am I going to be a half hour from now? Where am I going to be tomorrow? I said, so I don't think about it. I said, I come in here, you keep tabs on it. I said, I got so much going on. I said, I don't have time to think about it.
Now, if everybody could take that same approach, that would be fantastic. And you know, and you know, a lot of people suffer, like you said, anxiety from almost anything. Yeah. Anything. It's a fast-moving, paced world, and we're hoping that we can eliminate some of this and give a better quality of life for people.
Exactly. So we've got about 5 minutes left. What closing remarks do you want to tell our viewers?
Well, I guess do your research when you're out there looking for products to help you with, because there's a lot of stuff that don't actually have what they say it is in it. I would say that would probably be the first thing. And live life to the fullest, and every day enjoy it, because you're not promised tomorrow.
Exactly. Oh my God, I love it. That's my sentiments exactly. Ladies and gentlemen, you have heard it here first, and those are very true words. Live life to the fullest, because you don't even know from 1 minute to the next what's going to happen, okay? But you know what? Life is an extended runway, okay? And if you put that in your mind, no matter what age you are, you can just keep walking on that extended runway until there's no more runway to walk. And when you go to heaven, there's still a runway to walk. So anyway, thank you so much, Sean, for coming on the show.
Thank you for having me.
Oh, no, it was my pleasure. And these are things that our viewers and, you know, our audience needs to know. So once again, ladies and gentlemen, thank you for tuning in to Make Our World Your Runway. And as I always like to tell you, stay tuned, because every week we're going to have new and exciting guests. So thank you. Have a great Memorial Day, and we'll see you soon.